Sharsheret, and Cancer Wellness Center. Please note that you will be muted during the program. If you have questions, please submit them through the chat option. And now, without further ado, I'd like to welcome Dr. Gary Grad.
Hello, everybody. Appreciate everyone joining us today. I'm just going to get this up and running. So I am Gary Grad. I'm a medical oncologist in the Chicago suburbs. I've been in practice for 26 years at a group called Northwest Oncology and Hematology. I'm part-time clinically as of last year, and I also work for Tempus, which is a cancer genomic company here in the Chicago area and a data analytics company. And I have the honor of being on the ICRF Chicago board and international board. And I was asked to speak a little bit about COVID and cancer, focusing on the Chicago region. It's obviously a big topic, and I was given about 10 minutes to do it. So the good news is I'm not an infectious disease expert. I'm not an epidemiologist. I'm just an oncologist who's had to surf through all the unknowns along with our patients through this whole process and adapt as best we can. So I'll share some of that experience with you. This is good news. This was just posted last week, and it shows rising and falling new corona cases around the country. And you can see Illinois is in the dark green, which is a strong decrease in cases for that data through June 11th compared to 14 days prior. So you can see the places where there's been a strong decrease in new cases, as well as areas where there's been a large increase. All right, let's see if I can get my slides to advance now. There we go. This looks at total Illinois COVID positive patients. The blue is the cumulative, and the red is real time. And you can see as we move to May, June, the percent of increase by 24-hour period keeps dropping significantly. And if you look at the blue, it looks like there's a little bit of a plateau where previously there was a slope in the cumulative cases. And thank God we see the death rate in Illinois having peaked in early May, starting to continue to decline. And again, despite increased testing, which is shown here in the top slide in the yellow, in the 7-day period, we can see that the positive rate, despite increasing testing frequency, the positive rate keeps declining, which is a good sign. The bottom chart is from one of my hospitals, where we've tracked in yellow the number of patients admitted with suspicion of COVID based on symptoms, and then the actual rate of patients who tested positive. And we can see again that early May peak. And now, even though there's still similar numbers of suspicion, although maybe it's starting to tail down the last few weeks, the number of positive cases amongst those who come in and get tested is decreasing. So there's a little bit of a local taste of sort of what's happening. And this changes day by day, week by week. We literally get daily updates from all of our hospitals about what the statistics are doing. So how do we approach in 10 minutes COVID and cancer? So one question that comes up a lot is, are cancer patients at increased risk for complications of COVID? And the answer is we don't know for sure, and we don't know which patients, but some data is starting to come out. And the data is coming out in fits and starts. This was an article published in The Lancet, a very well-known journal from Europe, May 28th, just a couple of weeks ago. And it looked at 30-day mortality amongst cancer patients with COVID. And what they found was increased risk with increasing age, male gender, smoking, either active smoking or former smoking, a diminished performance status, and greater than 2 means basically that your functional status is limited where you're not out of bed for more than 50% of the day, active cancer patients as compared to those in remission or with no evidence of disease, and interestingly enough, a geographic increased risk for people in the northeastern United States as compared with Canada or the Midwestern United States. Some studies have reported no additional increased risk with active cancer therapies. Some studies coming out of New York, England, and Spain, while other studies, including a large international study, did suggest some increased risk with chemotherapy. Not so much seen with radiation therapy or some of the immunotherapy drugs. And some studies have suggested it doesn't matter what type of cancer you have, and other studies have suggested the hematologic malignancies, leukemias and lymphomas, myeloma, things like that, as well as lung cancer might have an increased risk of complications for COVID. One of the other things we've obviously faced are operational consequences of COVID on the delivery of cancer care and the workflow associated with that. One of the things that happened early on is that non-urgent and non-emergent procedures and diagnostics were suspended, which means mammograms weren't getting done or were being delayed, colonoscopies were being delayed, primary care visits were being delayed or shifted to a telehealth setting, dermatology visits, et cetera, gynecology visits. And then even patients who might have had diagnosis of a cancer, such as a breast cancer, surgery was being delayed if it was deemed not immediately urgent early on, with concerns about preserving limited supplies of personal protection equipment, ventilators, as well as limiting the spread to other patients and staff. There was a lot of unknown and fear early on, in addition to the limitations on ventilators and PPE. So for instance, we saw a surge of patients who otherwise might have gone to surgery first for estrogen receptor positive breast cancer that we were sent by the surgeons to put on endocrine therapy before surgery to control the disease until they can open up the operating rooms again for what they deemed as non-urgent. Obviously, a cancer patient sees those things differently than a hospital system might as regards urgency. Oncology office staff issues. Obviously our staff, our nurses and our front desk staff and the rest of our staff are at high rates of exposure to people as they're coming in and out of the office, runs the risk of diminished staffing if someone does get COVID and has to be quarantined, especially if their contacts also have to be quarantined. There were real supply chain issues early on, not just for enough personal protection equipment for our staff and patients, but even chemotherapy supply chains, for instance, which we have to get from a wholesaler, IV tubing, things like that. We were very concerned about those things. Some of us dealt with it by, as soon as we saw this coming, ordering 2 or 3 months of supplies in advance to prepare for possible supply chain interruption. And obviously high anxiety, both for patients and the staff. They were working, they were doing their job that they're obligated to do, but we could sense behind the scenes there was a lot of stress and anxiety on our staff in providing the care that we needed to provide. So some responses to the challenges in cancer care were telehealth emerging. The government was smart enough early on to allow telehealth visits and provide appropriate reimbursement for them and provide a structure for those to happen. Adequate testing became available. We now have the tests. The problem is working to figure out who to test. Do we test everybody when they walk in the door? Do we test everyone before chemotherapy? That could lead to delays in chemotherapy. Do we only test symptomatic patients? Do we test the whole staff, which could lead to potentially shutting down offices? So there's a lot of unknowns. The good news is most of the cancer centers in the Chicago area, and we all know each other quite well, and most of the directors have been in contact, working together to come up with best practices and algorithms about testing and office operations for our chemotherapy patients. Most offices have adopted universal screening. Patients are masked, they're screened before they can walk into the office. PPE for clinical staff and universal face masks for everybody in the office, as well as social distancing for staff and patients in the office itself. And we are now seeing this increase in caseload as we're a few months into this, as hospitals had started opening up screening procedures and interventional procedures again. So all those patients who might have had a little bit of a delay in being referred to an oncologist, we are seeing an uptick in that again now. What about the patient experience? There's some obvious effects on the patient experience, which is already stressful enough if you're coming to see an oncologist. No guests were allowed in our chemo suites, even in our waiting rooms. So patients were often there alone, being dropped off and picked up later. A lot of anxiety and fear on the part of patients, not just about their cancer, but about contracting COVID. in an office setting. Many wanted to delay their chemo or not do their chemo, some of which needed to be done because they had very aggressive, life-threatening cancers, and that added an extra layer of anxiety. And as a practitioner and a clinician, it was very difficult to do the things that we don't really think about consciously, but became evident as we started dealing with face masks, PPE, face shields that we were wearing. And it was just these layers of separation between us and the patient that really had the risk of impairing the empathic bond that we form with the patient as a care team. Social distancing was an issue. Eye contact is hard when you're wearing face shields. You can't see each other's facial expressions and express compassion. You can't hug, you can't hold a hand. And those things, again, are things that we take for granted as part of what we do and have kind of been brought to consciousness by the barriers that were put in for our ability to do that. I'm actually wearing a scrub shirt today as one of the examples too of one of the things that's happened in response to COVID is I haven't had real clothes on in about 3 months. It's which color pajamas to wear to work today. Let's see here. Medical education and research has been disrupted. Most clinical trial organizations suspended accrual to clinical trials, and that's a very important issue for patients with cancer, where many of our patients do go on clinical trials. Medical education was clearly interrupted. My daughter is a third-year medical student. Her board exams, which actually she's taking today as we speak, were canceled and rescheduled in different locations around the country about 4 different times in the last month as she was gearing up for those. And clinical rotations for medical students have also been interrupted. So instead of being in the burn unit at Cook County, where she's supposed to be now, she's doing an obesity medicine rotation online virtually. So a lot of unknowns with regards to medical education. And then major scientific meetings have been turned upside down. We recently had on the 1st of June, ASCO, the American Society of Clinical Oncology. It's our big national meeting. We usually get about 40,000 people into Chicago for that meeting every year. And it's a great coming together of academia, clinical oncology, industry, support groups, and we really lay out the plans and review all the advancements from the previous year and for the next year. And that all had to be done virtually and be coordinated very quickly. My hat's off to the organizing committee who did pull it off, but it's still not the same when you're not there face-to-face, networking with colleagues, setting up relationships for collaboration on new ideas. It's just different when there's that layer of virtual presence instead of real presence. The good news, in our geographic area, things are better, but it changes day by day. And as things loosen up with regards to restrictions, we'll see what happens. Screening procedures, supply chain, research are all back on track at this point. There's been an amazing nimble adaptation of cancer research platforms to COVID research. Academic centers have certainly been able to do this. And a couple examples I wanted to point out just because they're local and relevant to today's discussion. Dr. Ronit Sachi-Fanaro is an ICRF-sponsored scientist. She's the head of physiology at Tel Aviv University and runs the cancer research program there. And her research involves nano-vaccine platform for cancer, trying to come up with nano-vaccines against cancer. And she was very quickly able to adapt that platform for COVID research to try to develop a nano-vaccine for COVID, and is doing a lot of work there. Tempus, which is a company here in Chicago that I work with, a leading cancer data analytic company and molecular cancer sequencing company, we were able to adapt the platform very quickly to build a COVID research data and testing platform. And we're now supplying large-scale COVID testing with rapid turnaround time for oncology offices, as well as many other businesses and other agencies. So of course, our goal is to continue to provide as seamless as possible optimal evidence-based cancer care and clinical trials to patients in need while protecting the safety of patients and staff from COVID. ICRF supports innovative cancer research by Israeli scientists in Israel, optimizing their unique intellectual and entrepreneurial academic environment that we believe can change the world. And I have the website there to please go on and learn more. And I'll conclude with my prayers on behalf of all who are ill for strength, healing, and wholeness. Refuah Shlema.
And just a reminder to everyone, if you have any questions for Dr. Gary Grad, please submit them through the chat feature.
All right, I'm trying to stop sharing.
If we don't have any questions at the moment, we can move on to our next presenter. Dr.
Yeah.
One of the questions that came through is, what are your current views on travel? Example, Amtrak.
There's a lot of unknown about how to optimally limit exposure. So a couple things that have come up scientifically. We know that if we keep distance and we wear masks, we can significantly limit the exposure to droplets that are the main way that COVID is spread. And that includes mucous membranes, so mouth and nose, as well as eyes. So anything you can do to minimize your exposure to other people, which is distance, mask, so that you're not spreading droplets to other people. And when I travel, I actually will wear goggles or a face mask, even if I travel. I actually have been on an airplane, and I really have no risk factors other than being old. But I'm otherwise pretty healthy and don't have any classic risk factors, but I'm still pretty careful about protecting mucous membranes, wearing a mask, making sure anyone around me has a mask, and trying to keep my distance. So to the degree that you can optimize that, that's the best answer I can give you right now.
Dr. Grad, another question. As a person who is in treatment, what other precautions would you suggest we should take?
So again, the data is mixed. There are some studies that say that patients who've gotten chemotherapy up to 4 weeks before or may not be at increased risk. A lot of other studies have suggested patients with active cancer or active treatment may be at risk, especially lung cancer, hematologic malignancies. It depends on the treatment. Some treatments are more immunosuppressive than others. So endocrine therapy is not the same as someone who's on cytotoxic chemotherapy, or radiation therapy is not the same as immune suppressive chemotherapy. So the best thing you can do, again, minimize your exposure to other people, because that's where you're going to get this virus. You're going to get exposed through other people, spreading this through droplets. And the most you can minimize yourself, you're going to lower your risk. It's all about risk benefit. Someone has a follow-up about N95 masks on there. So the whole thing about N95 masks is what you're really doing is you're protecting other people from your droplets. There are very good masks that we use that we get specifically fitted for that can help minimize our exposure, but I also wear a face shield to prevent droplet exposure, both for my eyes and for any droplets. The key of the N95 mask is to prevent you spreading those droplets to other people. And distancing is still the best way to do it. There's actually scientific data that has suggested you significantly decrease the risk of spreading COVID droplets if you're wearing a mask compared to not wearing a mask. The N95 masks with the little vent that have one-way vent, those allow any droplets that you may have if you cough or sneeze to go out through that vent and still expose other people. And since the whole purpose of those masks is to protect your spreading droplets to other people, those kind of defeat the purpose a little bit, although they do somewhat lower the risk of you getting droplets that might be in the air. So they're not completely ineffective. It's not all or none. It's all about minimizing risk as best we can, and that's distancing and some barrier so that we're not spreading droplets towards other people if we ourselves are infected. You see another question about risk for cancer patients taking estrogen blockers. We don't have a lot of data on that. Again, it's not a cytotoxic therapy. What we do know is there is some data suggesting men may be at increased risk, and whether that has to do with the fact that they have less estrogen or not is complete extrapolation. But that seems independent of any documented data that has suggested that endocrine therapy necessarily increases your risk above the general population. It also doesn't seem to eliminate all the other risk factors if you have hypertension, diabetes, tobacco history, lung disease, age, etc. And I could certainly stay around at the end if there's more questions, but I want Becky to be able to have her time also.
If we don't have any more questions for Dr. Grad, we could go through, and Lori Bumbaco will be our next presenter. Lori, if you're able to come through, perfect.
And I just unmuted myself, so hopefully everyone can hear me okay. Good afternoon. So I'll introduce myself quickly. My name is Lori Bumbaco, and I'm a dietitian, and I'm also a board certified specialist in oncology nutrition. So I thought today I would take the opportunity to discuss the nutrition lessons that we learned as a result of the COVID-19 pandemic. I also have a PowerPoint presentation, so I'm going to share my screen with you now, and I'll see you in a moment. So during the quarantine, I worked with a lot of individuals who were struggling because their eating habits changed, whether it be because they were working remotely or not going out to eat anymore. They felt like they were off of their normal routine. A lot of people share that they were emotionally eating, and so they turned to food for comfort because maybe they felt lonely or isolated or struggled with anxiety or even were just bored. Most of us were minimizing our trips to the grocery store, and so I got asked a lot of questions about what staples to stock in the kitchen so that they all can continue to eat as healthfully as possible. And I got some surprising questions about using dietary supplements as a way to boost immune function. And so I think today is really as good a day as any to sort of hit the reset button. And I'd like to present some information for you so that you can make the best decisions for yourself as you navigate the next steps moving forward. Okay, so on the agenda, I'd like to introduce what I call a nourishing plate, highlight specific nutrients for immune function, and then end with some nourishing kitchen staples. And I would like to share with you my choice for the #1 staple, and I'll explain why and how to use that staple. So here you see a visual guide to healthy eating, and we call this the New American Plate. And what you'll notice about this plate is that 2/3 of the plate is occupied by plant foods. And so you see some colorful vegetables there, but fruit also would belong on this side of the plate. And then we also include starches and some whole grains. The remaining third of the plate is reserved for our protein foods. And so you see chicken is an animal source of protein, but we also can rely on some plant proteins, for example, something like beans, which is a quality protein as well. Now, when we plan most of our meals to look like this plate, we are in pursuit of a nutrient-dense diet. And what that really means is that the foods that we eat most often are packed with nutrition while being relatively low in calories. And as it turns out, this is probably, from a nutritional perspective, the single best thing we can do to minimize risk for disease, including cancer. So now let's talk about nutrition and immunity. Did you know that vitamins and minerals are micro nutrients. So we only require micro amounts in our diet. That means a very, very, very little bit in our diet. And I mention this because our society tends to have the thought that if we have a lot of something, it must be really good for us. And that's not the case with vitamins and minerals. In fact, we only need just the right amount. And we refer to this as the Goldilocks effect. So if we eat too little of a vitamin or a mineral, we could cause a deficiency, and this would be detrimental for our immune system. But on the other hand, if we took a high dose supplement of a vitamin or a mineral, this could cause a toxicity. And that is also detrimental for our immune function. So the bottom line is that we want to apply this principle of food first and supplements second. So what that means is that if we pursue a nutrient-dense diet, this is the ideal way to optimize our immune function using nutrition. So rather than filling your medicine cabinet with dietary supplements, let's review some of the foods that provide us with essential nutrients to support our immune function. I want to first start with omega-3 fats, and they are essential to help keep unwanted inflammation in check. Now, interestingly, 95% of Americans do not consume recommended amounts of omega-3 fats. The experts suggest we eat 2 servings of fatty fish per week, so I listed 2 of the great choices and how much omega-3s they contain. Vitamin A is a cofactor, and it's responsible to synthesize immune cells, specifically those that line our digestive as well as our respiratory systems. So men and women require different amounts of vitamin A, and I've listed 2 of the top sources in our diet. Vitamin C is a potent antioxidant, and it has the responsibility to protect immune cells, and it kind of works like a barrier, so it prevents the pathogens from damaging our immune cells. And vitamin C is ubiquitous in plant foods, and you might be surprised I've listed 2 choices there, how high in vitamin C they are. Next is vitamin E, and this is another antioxidant, and it has the responsibility to protect our immune cells, specifically the integrity of their cell membranes. And I've listed 2 choices there and how much vitamin E they each have. Zinc is a mineral, and this functions as a precursor, so it helps to synthesize new immune cells. Men and women require different amounts of zinc in the diet. And believe it or not, oysters, maybe you knew this, oysters are our best source of zinc, but I wanted to include 2 other choices for you there, and especially a plant-based choice. So those vegetarian baked beans are a good source of zinc. And then lastly, vitamin D. Vitamin D has a lot of responsibilities in terms of activating, sort of regulating our immune system function. Now, 96% of Americans do not eat enough vitamin D. This isn't a surprise because it's not readily found in our food supply. We call vitamin D the sunshine vitamin, and that's because this time of year when the temperature is 70 degrees or higher, if we expose our skin for about 10 or 15 minutes several times per week, we convert the UVB rays to vitamin D in our body. So now, although I did just highlight some specific nutrients, I wanted to come back to this checklist because I think we want to take a holistic approach if we're trying to optimize immune function. So we want to consider a nutrient-dense diet, not to rely on dietary supplements for any sort of boost, but also integrate these other factors like regular exercise, adequate rest, managing our stress, and staying connected with others. So now let's focus on some nourishing staples, and I've listed here what I would consider the characteristics of a nourishing staple. It's something that we eat on a regular basis. It could be shelf stable, refrigerated, or frozen. It's versatile, and it's budget friendly, my favorite. So if we're going to pursue a nutrient-dense diet, let's first start with the pantry. So these are the items that I would argue belong in everyone's pantry. You see canned beans, box soup, whole grains, nuts and seeds, as well as their butter versions, oils and vinegars, our canned fish for those omega-3 fats, as well as spices and herbs because they impart flavor, but historically they were used for their medicinal properties. Next, let's take a peek inside the fridge. And I listed first some budget-friendly quality proteins like eggs and tofu, as well as low-fat dairy. And then I listed some fruits and vegetables that have a relatively long shelf life. So when these are stored properly, whether they be in the fridge or in the pantry, these will last you for almost 2 weeks, some even longer. Hummus is a versatile staple, and I'm going to demonstrate why that is in just a moment, and then poultry and fish. And then last but not least, let's take a look at the freezer. And in the grocery store, I think the frozen food section is like a treasure for convenient, nutritious options. So we have frozen fruit, frozen vegetables. We even now have frozen whole grains like brown rice or quinoa that is pre-cooked. So all it requires us to do is reheat it. You couldn't get more simple than that. I just want to remind you to double check ingredients, and we're looking to minimize those unwanted additives like sugars or salt or fat. I also like to recommend frozen garlic and ginger cubes, because you literally pop a cube out of the freezer into your skillet or into your saucepan, and you're well on your way to making a stir fry, a sauce, or even a soup. So if I were to choose my #1 pick for a nourishing staple, I have to go with canned beans. They are a nutritional powerhouse. So they are a good source of plant-based protein, an excellent source of fiber, which Americans also do not eat enough of, and they're also rich in iron. So while they are not really a flashy staple food, I think that unless we invite canned beans, we cannot have a party in the pantry. The other reason why I think beans are the #1 choice is that they're quite versatile. So I've included here 4 suggestions for meals that showcase beans as the starring ingredient. And that's for breakfast, lunch, dinner, snacks, and believe it or not, even dessert. Each of these uses beans. I'd like to point out, you'll notice some traditional ethnic recipes like shakshuka, ful medames, as well as pasta visual. That's because the rest of the world uses beans as a staple, and it's a shame that Americans haven't really quite caught on to that. I think we're missing out. So I have on there a plant-based chickpea salad, and if I have a moment, I'm going to just demonstrate that to you when I stop screen sharing. If you're looking for more information, I recommend these websites for searching recipes. So if you're stuck with some ingredients that you need to get rid of, or you're looking for inspiration for new ones, you can plug any ingredients you have into their database, and it will generate a ton of recipes. Some of them have some smartphone apps, as well as the opportunity to generate a grocery list. These are great websites for additional nutrition information if you're curious. And in summary, I just want to remind you all that really ideally, the best way to optimize our nutritional wellness is using that nourishing plate model. We want to rely on food first, supplements second. And now it's farm market season. So if you feel the farm markets are quite secure, I encourage you to try some local seasonal produce and combine that with some of your staples. This really helps us to combine the best of both worlds. Okay, so I'm going to stop screen sharing. And I'm just going to very quickly try to demonstrate to you, unfortunately in my own home, not the demo kitchen, that plant-based chickpea salad. So what I did is I took one of our staples, canned chickpeas. I drained and I rinsed them. And then I'm going to add my chopped celery and carrots, as well as some minced shallot. And then I'm going to add to that some fresh herbs. So I have some fresh parsley, as well as some fresh tarragon. And I'm just going to combine those together. I forgot an important step. What I did is I mashed the chickpeas. So I just used a fork and I mashed them to my desired consistency. So I'm just going to combine them together. I'll just lower the camera. And now I need to dress this, right? I want to make a sauce for that. So I'm going to use another great kitchen staple, and that's hummus. And so hummus is kind of like a blank slate that we could dress up, right? So I'm going to take a couple tablespoons of hummus and add to that another one of my favorites, Dijon mustard, for some great flavor. And then I'm going to add some paprika. And hopefully you can see it. There we go. Some salt and pepper. and then some lemon juice. So that's the juice of 1 lemon, and I'm gonna just go back to using my fork, and I'm gonna whisk this together. And you will find this will make a pourable sauce or a dressing, and you could use this in more ways than one, but I'm gonna add this to our chickpeas. So it literally pours right on into our bowl. I'm even doing this sitting down. And voila. So I'm just gonna combine that together. And now this is delicious as is, but I like to make a sandwich with this, or sometimes I'll spread it on toast. Some people like to wrap it in lettuce wraps. It'll last for a couple days, but hopefully it just gives you one example of so many different ways to use such a great staple food like beans. So that is all I have if we have questions.
It looks like we have a few questions. Can you see the chat, Lori?
I can.
So it looks like you could discuss hummus a little bit more.
Sure, I will definitely share my PowerPoint presentation. Thank you, Savina. I'm not sure where you might have seen any information about chickpeas or hummus. I'm not familiar with any new information regarding that they might be detrimental to our health. Sometimes there's a myth I like to bust quite often that some of the foods we eat are estrogenic, when in fact that's just not possible. The estrogen that our body makes, it doesn't, the foods that we eat, if they possess any phytoestrogen properties, it doesn't influence our own body's estrogen at all. It almost has to do, like a good analogy is a lock and a key. The estrogen that might be found in some plant foods the key doesn't fit into the lock in our gut. And so it doesn't even recognize what it is. But I would argue that what's in beans or hummus or tahini offers such valuable nutrition. It's like a package. So while some might have estrogen-like properties, there are already so many other healthful qualities that round it out to make it a great choice. Instead of hummus, you certainly could use tahini if you like tahini. I sometimes, instead of chickpeas, will use navy beans because they will mash, and you could add that. You can add water to navy beans and it will mash to the same consistency as hummus. Or you could just use oil and vinegar. I think that would dress this very nicely. Canned beans, a lot of questions about salt in canned beans. And what we find out is that when we rinse them well, it removes 40% of the salt, which is significant. But there are a lot of options out there now because companies are making consumer health-friendly choices. So there are no added salt bean products, or you could conversely just use some dried beans, which have no salt added. So that might be a good option. We have another really sort of like a medical nutrition therapy that I would love to address individually one-on-one. I don't think that this is the platform to do that. I'm not sure the best way to help with that question though. I'm wondering, Becky, is that something that I should address individually?
I think generally maybe what are some good foods to help build muscle mass? And again, I think some of these questions might be best addressed or one-on-one with a dietitian. But in general, what would you suggest for building muscle mass?
Muscle mass. What a great question that is. And I get asked that so many times. And I want to encourage you to report that back to your healthcare team, because I think that's something that needs to be addressed. Unfortunately, we don't know of any specific nutrition intervention that builds muscle mass. What builds muscle mass seems to be using muscle mass. And so this requires some resistance exercise. So again, if that's a conversation to have with your healthcare team to see if that is a possibility for you. Of course, adequate nutrition and well planning to ensure that you're incorporating protein in the right amounts, because it's Goldilocks effect. Too much could be detrimental. So you would just need appropriate guidance on an individual level for what are the specific goals for you.
Thank you, Lori. Just to be mindful of time, I think we can move on to Becky. If there are any more nutrition questions, especially even specific ones to your own personal diet, Lori does see clients at the Cancer Wellness Center for one-on-one. And in order to get connected, just go to our website to learn more and call to schedule an intake. Thank you, Lori.
It's a pleasure. Thank you.
Okay, hi everyone. I'm going to share my screen. Okay, and can everyone see that? We're good?
We can see it, thank you.
Okay, wonderful. I'm very happy to be here with you all today, and just to be mindful, no pun intended, to be mindful of the time, I'm just going to jump right in. So first, I'm just going to encourage you to do something that can be very difficult in these times, and it's something I'm guilty of as well. I'm going to encourage you to put away your phone or put it face down, especially with all the Zooms and the WebExes and the webinars and FaceTimes. It's, we're constantly having a million screens in our faces, but just for the sake, the next 5 to 10 minutes, I'm going to encourage you to put your phone away. Just so we can be present and kind of do this exercise without any distractions. So I can't see any of you, but imagine we're all in a room together, and I'm going to ask who has had to cancel a vacation or a gathering, a family function, a wedding, a party, something fun they were looking forward to over the past few months. I imagine I would see everyone nodding, raising hands. We've all had to cancel vacations, fun things that we were looking forward to, perhaps for weeks, months, years. And so right now, I just want to take this opportunity to take a short little vacation. I know it's not as good as the real thing, but just to kind of show you that it's possible to get a moment to relax in, amidst all the chaos and our busy days. So everyone can, phones away, get comfortable, can sit up straight with your feet firmly planted on the floor. Relax your arms, your neck, your shoulders, your back, down along your spine. Feel your body loosening up, relaxing. Down your legs, your feet, your toes. Wiggle your toes. Feel the tension that you've been holding in your toes and your feet. Feel it just melt away. Breathe in deeply into your diaphragm, drawing air fully into your lungs. Hold it for a second and release the air through your nose. In through your nose, out through your mouth. Breathe in again, slowly. Pause for a moment. Breathe out. Try to feel yourself becoming more and more relaxed with each breath. So now you can either close your eyes or set your gaze softly somewhere. You can look at this screen at this lovely beach and imagine you're walking toward the ocean. You can hear the waves up ahead. You can smell the ocean spray. The air is warm. Feel a pleasant, cool breeze blowing. You see the bright aqua color of the ocean ahead. The long stretch of white sand, as soft as powder. Imagine taking off your shoes and you can walk through the warm white sand toward the water. You hear the waves crashing on the shore. Look again at the water. It's a bright blue-green. You can see right through it to the bottom of the ocean. See the waves washing up on the sand, receding back toward the ocean, washing up and flowing back down. Enjoy this rhythm, the sound of the waves. And the wave washes over the sand toward you and touches your toes before receding. The water is the perfect temperature, providing relief from the warm sand. It's cool, but not too cold. You stand there for several minutes, feeling the cool waves washing over your feet, and then receding, washing over your feet, and then receding. You feel a sense of peace, you feel relaxed. Take a deep breath in, breathe in the ocean air, breathe out. A few more times, in through your nose, out through your mouth. Now slowly return back to your normal surroundings, back from our mini vacation. Open your eyes, stretch your muscles, roll your shoulders, you can stretch your arms, wiggle your toes, become fully alert back to your surroundings. I know this was a brief little mindfulness visualization exercise, but it's very easy to do if you ever feel like you need a break or to have a moment to yourself amidst the chaos and uncertainty of everything going on around us today. There's so many more like this, and I'm sure many of you have done visualization or mindfulness exercises before, but if not, if you want any samples of any, I'm happy to send them out after. So now I just want to touch briefly, again, being mindful of the time, on mental and emotional well-being during COVID-19. So it's been several months now, and I'm sure you've all been hearing over and over about emotional well-being and how to make sure you're taking care of yourself mentally, emotionally, physically during this uncertain time. So I'm not going to beat a dead horse. I'm not going to restate the obvious. This has been really hard in so many ways on everyone, especially if you're immunocompromised or actively going through treatment or diagnosis, or if you've had to have surgeries or treatments delayed. So now what I want to talk about is this kind of unique pocket of time we're in right now, which is the challenges we're going to be facing in the coming weeks and months as things start to reopen. Things are going to start to change a little bit. It's no longer necessarily a question of how do I manage while being stuck inside all the time. For many of us, it might start to become, how do I manage reintegrating back into society to some degree, back, out to running errands, going out to dinner at an outdoor restaurant. How comfortable am I to start doing this again? How safe is it for me? Outdoor restaurants, mingling in crowds of less than 10 people or more than 10 people. This is a brand new challenge that none of us have ever faced before, that might present some sort of discomfort for many of us. After months and months of quarantine and isolation and social distancing, some people might feel a sense of relief at being able to get back outside and see people from a distance or close up. For others, it might be very unsettling and very anxiety provoking. So however you're feeling about it, whether you're eager to get out to an outdoor restaurant or you'd like to stay home longer and wait it out and see how things play out over the next few months, it's okay. I just want to say, trust your gut, be kind to yourself. It's about what doing makes you comfortable. We're all going to have different comfort levels with this. I want to encourage you, each and every one of you, to speak with your physicians, your oncologists, your primary care physicians, and listen to them and what they have to say, whether you're immunocompromised or not, based on your own personal risk factors. Do what makes you feel comfortable based on your own situation. And again, just be kind to yourself, because every reaction right now is a normal reaction. There's no right way to feel about everything that's going on, the same way there was no right way to feel back in February, March when this all started. There's no right way to feel right now. Everything's normal. Every reaction is normal and okay. And your friends and family may all be handling these new phases of reopening differently. And we're all just gonna have to take it one day at a time, the way we've had to since this began. And kind of like Dr. Grad said, there's some things that we just don't know yet, and we just have to take it a day at a time. And I want to encourage each and every one of you to reach out for support. if you feel like you need support, whether it's from friends or family, or it's any one of our organizations, this is why we're here, to support you, to listen, to, you know, provide you, connect you with any resources you may need that can help you through this time. We're here. We're all up and running, and we're here for you, locally in Chicago, whether it's in person or over the phone or email. So thank you so much for your time. And if anyone has any questions, I am happy to take them now. And if we don't have any questions, I guess we have a few minutes now. If anyone has questions also, it looks like Lori and Gary are still here. So if anyone has questions for Lori or Gary, you can also feel free to send those in through the chat now. And we'll give you a minute or so if you have something.
Becky, I received a private question, is how do you support someone who has treatment?
Who has what?
Who is going through treatment?
How to support someone going through treatment? Like, if, are you meaning like if you have a loved one going through treatment, I assume?
I believe so.
Okay. That's a really good question. And at Sharsheret, that's actually part of what I do as a social worker. Is I not only speak to women and families going through, or women going through cancer diagnoses, but also their family and friends who are asking how to support them. So this is a bit of a unique time, because a lot of the things that we think of when we support friends or family is, you know, bringing meals over, you know, helping with laundry, helping around the house, helping drive, you know, accompany to appointments, taking people's kids for play dates. And with everything going on right now, a lot of that isn't really possible or recommended. You know, accompanying people to appointments or coming over and helping them around the house. You know, people are kind of keeping a bit of a distance because of everything going on. So, you know, I think the best way, and this is, again, I'll give a very abbreviated answer, and I'm happy to chat more with whoever asked the question offline, or if they want to shoot me an email or give me a call. I think to just listen. You know, we have phone, we have FaceTime, we have email. Just, you know, check in on this person, let them know you're there for whatever they need, even if, you know, just listen to them and listen to their needs and their concerns, and however you can help. You know, it's not always about distracting the person or trying to make them laugh and not asking them about how they're doing. Because I know it can be uncomfortable sometimes to you know, keep bringing it up and ask about treatment, or ask how they're feeling, or ask about side effects. But I think just generally to follow your friend or loved one's lead in terms of what kind of support they need is a quick answer to that. But again, feel free to email me after, and I'll put my email in the chat, and then we can set up a time to talk more about it, because it's hard to know what to do even in normal times, let alone with everything going on.
We do have another question that came through kind of privately, is do you have specific instructions for being at an outdoor restaurant? Example, table, chair, silverware to protect us. And this could be a question for anyone.
I'm assuming this question was probably for Dr. Grad. So I'm not sure he'll have, you know, the answer, but he'll have probably an answer.
The best advice I can give is don't abandon your common sense. And I tell that to patients all the time. We'll sit down in an office and we'll go through all the potential complications of a chemotherapy regimen. And at the end of the day, the patient says, well, what am I supposed to do? And probably the most important thing is don't abandon your common sense. As I said, the biggest thing to lower the risk of exposure is distancing from other people, assuming that they have it, and if they cough or sneeze, that they're going to spread droplets that could be infectious. And anything you can do to minimize your contact with that is ideal, especially at a restaurant where you're going to have your face mask off. They're going to have their face masks off. So you really want to pay attention to that 6+ foot distancing at that point, and do the best you can, and try to limit your exposure as best you can. Some people would take that to the extreme and say, I'm just not going to go out and eat yet until there's a clear, much lower sustained diminished incidence. And other people say, I'm going to go out and I'm going to just be as cautious as I can and distance myself as much as I can. But there's no absolute right answer. If you do see a situation in a restaurant where people are gathering, where the tables aren't set up for distancing, then, you know, as a cancer patient, I probably would find another place to go.
Great, thank you so much, Dr. Grad. If we have no more questions, I think what I'll do is pass the mic over to Allie from ICRF to kind of say some closing words. So there you go, Allie. Here, we're going to need to unmute you. You should be.
All right, I think, there we go. Thanks so much. Sorry about that little disruption there. I just want to say, my name is Allie Marks Greenfield, and I'm the Chicago Executive Director of the Israel Cancer Research Fund. And along with Sharsheret and the Cancer Wellness Center, we just want to thank you for spending your lunch hour with us. I think everyone would agree that we had 3 amazing speakers today, and a big shout out and thanks to Dr. Grad, Gary Grad, to Lori Bumbaco, and to Becky Koren for giving us the latest and best news on cancer and COVID in Chicago, some great nutrition tips, and some well-needed relaxation methods, what I'm going to try tonight before I go to sleep. We hope all of you have enjoyed the hour, and we wish you all just good health and happiness during these crazy times. And we hope in the future you'll join us again for other webinars. So thanks so much. And please feel free to send emails or reach out to any of these organizations to answer any questions you may have in the future. Again, thanks so much.